Good afternoon, everyone. It's with great pleasure that I bring to you another in our series of visiting professors. And I am, as you know, a vascular surgeon who has been involved with over the past 50 years with compression therapy, wounds, wrapping, and so forth. And this has been a very important thing because of the millions of patients that are affected by this. And you'll notice in the background, we have giraffes, and you're going to understand before we're done the importance of the giraffes. It's a real honor today in this visiting professor series to be able to share with you Claudia Boyle, who I've worked with for over a quarter of a century and has helped in thousands of patients to help them with their leg problems. Good afternoon and welcome, Claudia.
Thank you, Dr. Caprini. It's a pleasure to be here. I'm looking forward to looking at all the important things we're going to be looking at in terms of compression.
So let's talk about the secret of the giraffe leg and why this is important for the health of our legs. Here we see a typical example, a 95-year-old woman who came in and she had surgical stockings on that were given to her after an operation. And despite that, look at the leg swelling. And here is another example in a person with a very heavy rubber 40 to 50 millimeter stocking to control severe swelling. It's not controlling it. Very difficult to get on and off, by the way. And here are several more examples. And this is a post-thrombotic patient at the bottom here. Claudia, I'm sure you've seen a lot of these in your practice.
We sure have. You know, the compression stockings are made with a type of elastic that really squeezes to compress. And in some instances, it squeezes inappropriately or doesn't squeeze sufficiently, as in the case of the picture on the left. And we can either get inadequate compression or constriction, and we get impressions like we see. And these can lead to real problems, not to mention discomfort.
So the characteristics of elastic compression is that it has a high resting pressure. You have to put it on rather tightly so the bandage doesn't fall down. But it has a low ambulatory pressure. So as the patient walks, the bandage expands because it's elastic and the edema increases. And we have a thing called static stiffness index, and that's the difference between the pressure measured underneath the wrap or stocking, lying, compared to the pressure standing and walking. And a good compression device ought to have a standing stiffness index of 10 millimeters, which means at least 10 millimeters higher when walking than with resting. And here you can see the anti-embolism stockings that were on that lady, and whether the patient is lying, standing, exercising, or recovering, that it doesn't make any difference. That patient is still not getting any compression, and therefore it's a real problem in terms of decreasing edema. Actually, edema increases and then it gets tighter. So now, Claudia, tell us about this giraffe. What's this all about with the giraffe?
So why giraffes? Giraffes have with their very long legs, have a unique property that prevents their legs from swelling. So you would think a giraffe with those enormous legs would get a lot of swelling when they're standing around, and they don't. So most people are not aware that giraffes have a venous pressure of more than 250 millimeters of mercury at their ankles. Amazing. That's 3 times more than humans. However, giraffes do not suffer from lymphedema or venous disorders. Physiologists have discovered that the answer is in the skin. Giraffe skin is inelastic, so it does not stretch. As their leg muscles contract, the veins in the legs are squeezed, forcing the blood upward toward the heart. Thus, giraffes are not susceptible to problems like lymphedema and venous disease, even though they may be on their feet 24 hours a day. Magical.
That's amazing. So their skin is like a steel tube. So when the muscles contract, the blood has no choice but to go back to the heart.
Exactly.
So let's talk about that type of compression. Short stretch compression, and that would be, for example, with a linen or cotton bandage that doesn't stretch at all, and you would just wrap it around the leg. You don't have to put it on really tightly, just wrap it around to be secure, and it has a low resting pressure. But as the patient walks, the pressure, the bandage that doesn't give way, it's just like the giraffe's leg. So the blood has no choice but to go out of the leg. Usually you'll have a standing stiffness index of over 10 millimeters. Now there's many roads to Rome, as you know, and there's a so-called Una's boot or jello cast boot. It's actually this paste in a boot that has been used in for
Old
many
school.
years. As a matter of fact, Dr. Una was before the turn of the 20th century that was using this. Now, short stretch bandages are the preferred way, but there was also elastic bandages if wrapped one over the other will give a short stretch picture. And then there are what we really want to get into today, which are Velcro and other strap devices.
Exactly. And you know, a way I like to sort of explain the difference between the long stretch and the short stretch garments is that the elastic long stretch garments, they're going to be squeezing that leg all day, and all day they're squeezing, and that leg underneath there is trying to swell, and the leg is squeezing. And at some point, that squeezing, swelling can start to result in constriction or real discomfort after a while, because no matter if people are lying, standing, that stocking is squeezing just as much. The Velcro wraps and short stretch, this kind of design, they just hold you firmly. They kind of lock into place and hold you firmly, which results in good, not only good compression, but tremendous comfort, no matter what position you're in. And you don't get that end of the day, like, oh my God, feeling from the short stretch.
And so these bandages were Velcro compression, but now there's other strap compressions that are similar. It's just not using Velcro to hold them in place. They use clips or other devices.
Right.
And the donning and doffing are extremely fast and efficient. We're going to show you some videos of putting these on and off and show you how really easy it is to work with them. And, you know, I've had patients come in, we put the device on them, they've gone out, and then they call me up on the phone. I always give them my phone number. Call me up, Dr. Caprini, this worked great the first day or two, but now all of a sudden they've gotten loose and they're falling down. Well, I said, that's the beauty of this bandage. As they loosen, that's because the swelling is going down in the leg. The leg is getting smaller, so all you have to do is tighten them. And that's just such a nice thing. On the other hand, when somebody has had a swollen leg for a long time, and you try to put compression on them, initially they may have some pain and discomfort, and it takes time to get used to it. So what they can do is they can loosen the straps, and that will often help them get over the hump. And so this is a very flexible device. And
Exactly.
I think that's very important.
It is. With the stockings, a stocking is either on or off. There's no in between. But the Velcro wraps have a tremendous range of comfort. So as the leg changes or your level of comfort with compression changes, it's almost endlessly adjustable.
Now here's a typical picture. This is a measuring device that's put underneath the Velcro. And you can see the difference between 40 millimeters at resting, and then it goes up to almost 60 millimeters with walking and so forth. And eventually this will lead to a lowering of the pressure because it'll get a little loose and then you can tighten it. But you can see the dynamics here, and this pulsatile arrangement as you walk actually can cause incompetent veins to open and close and become competent. So it's a very, very unique mechanism, and it's best depicted using these techniques.
Wow, that's amazing. I didn't know that.
Yeah, and you know, we're done with stockings, and we have, if you take a drug, every drug has a dose. Well, now with a device, there's two devices out. One's called a Pico Press, the other is a Juzo measuring device. With these devices, you can get a dose of compression about what you're putting on the legs. Very, very important.
Remarkable.
Now let's go back to that 95-year-old lady. I put her in a short stretch bandage and voila, 1 week. Look at those legs. Ready for prime time. Now what? Does she walk off into the sunset? No, she'll be back with a leg looking like that very quickly. So we put her in Velcro devices, and the Velcro devices will control that swelling indefinitely and keep her nice and comfortable.
I can't believe how great she looks.
So here are some other Velcro devices, just to give you some examples. And one of the things that I'm trying to illustrate here, perhaps you'll comment on, Claudia, is we discourage people from wearing slippers like in that first example. And we either have to wrap the feet, or lace boots or lace shoes are really important as far as controlling the swelling.
Yeah, this is a beautiful illustration. On the picture on the left, you can kind of see that the gentleman is wearing a partial compression liner that's often used with the wraps. And the foot and the ankle below at the lower end are not particularly well managed because of that. Whereas with the bandaging in the center picture, or those really amazing lace boots on the right, we're using the shoe in that case as part of the compression program, which, everybody has shoes, and so it makes sense.
And the tendency is to shy away from those lace shoes because if they use slippers, the slipper will accommodate the swelling and their foot is comfortable. But
Exactly.
that's not the game, is it?
No, no. And the problem with, a lot of times, often I see people come in, especially women, where they get the really puffy feet and they're wearing little ballet flats or something because they really do have a hard time getting into something else. But wherever that shoe ends rigidly, if you don't have a lace, no stocking, nothing is going to stop. It can compensate for that abrupt end of compression from the shoe. So you get this additional swelling in the foot, which is just, not a good thing. So some kind of lace shoe, and it doesn't have to necessarily be a boot, but it needs to be something that has lace or possibly Velcro that kind of meets the compression garment at the bottom. So we get this nice continual movement of all the fluid.
And by the way, all of this focus on preventing swelling is because the swelling can lead to chronic changes. You can get open sores on your leg, or worse yet, you can develop blood clots. So this is a really important thing to aggressively attack this problem of swelling.
It sure is. And it also, another thing that gets overlooked sometimes is that fluid is heavy and it changes how people walk and it makes people more likely to fall. We need to move that fluid. It's not good to let it sit down there.
That's right. So here's some of the indications of, older age folks. I'm in my 80s now, and I find that my hands, they look like they're okay, but they don't work like they used to. And it's harder and harder to get stockings on and off and so forth. Or you have weakness, you have arthritis, or you're very heavy. Advanced pregnancy is another reason you can't bend over. Or you have restricted mobility, bad hips, bad legs, bad knees. Or lymphedema, where you have swelling. And most importantly, if you have swelling that's not controlled with stockings, or where you have leg wounds, where you can't compress the patient. Sometimes once the acute drainage is down, we can use these Velcro-like devices or strap devices to treat actual leg ulcers, and patients can take them off in the morning, they can shower, they can redress their wound, and then put back a nice, tight, short stretch compression, which is the Velcro, and that'll help to heal their legs.
Yeah, it's fantastic. So other reasons we might need to work with a Velcro, or a Velcro might be better indicated, are people who are having joint replacement. That kind of swelling can be pretty tenacious, and it's going to vary tremendously after the surgery. So the Velcro is not only better compression, it's far more adjustable. Patients who have severe leg swelling, we often see people, especially as they get older, who their leg needs more compression than they could possibly get on or off in a stocking, where the Velcro wrap, they're able to tighten that up in a way that provides enough compression, so it's the better option. Advanced swelling, yeah, there are some kinds of swelling that no short stretch stocking is going to touch, and the Velcro does a nice job of it. And patients who have limitations on movement after surgery often are able to work with a Velcro wrap, or have a loved one apply the Velcro wrap, which leads to far less fighting than having a loved one apply a compression stocking.
But sometimes it's not a pretty picture.
No.
So just continuing along this line, patients with large abdominal girth have increased leg venous pressure, because as bigger the abdominal pannus or gets, then the more pressure intra-abdominally, and that puts pressure on the veins and slows down blood flow out of the legs. And that's why sometimes even the really good stockings are not able to control things. And in addition to that, are difficult to apply and remove. Now, here's a typical example we see in a lot of patients. And this patient, you can see, also has foot swelling. Look at the dome on the foot. You can't see any veins in the feet, and the ankle bones are obscured, and then there's an ulcer behind the knee, behind the calf. And this is very, very treatable with compression bandages. And then you get this, and I remember this happened. This was a lady, and with a good compression dressing that I put on, we healed this in less than a week, because it was a very surface ulcer. But
Wow.
so then she walked out happy as a clam, but only to come back later with a worse ulcer because there was no follow-up. and putting a velcro on this patient, which is what we recommended, but she didn't get for one reason or another. Um, this would have saved that problem. And of course, once ulcers recur, they're much more difficult to treat. I'm sure you've seen a lot of this in your practice, because I know you deal with local wound centers that send you their patients.
Exactly, exactly. A little bit of maintenance goes a long way.
Now, here is one of the most dramatic examples. This is a lady that had a blood clot in her legs after total hip replacement, and later developed what we call venous insufficiency induced lymphedema. And you can see the foot is all swollen, the ankles are swollen, and there's ulcers on the legs. And this patient's in a wheelchair. And after a while, these patients just lose all hope because it's such a difficult thing to deal with. And I would like to show you, this is another patient. This patient's legs were just as bad as that person's. And this patient was a person that delivered supplies on a cart to the operating rooms, going room to room. So he was on his feet all day long. And he had to give up his job because he had these legs like I just showed you in that previous picture. We worked with him, and he worked himself, and he could put his own bandages on. And here we see a very advanced velcro device that's used on his legs. And you see the shoes, and you see the lace. And after this took about a year of work to get back to normal, he's now back to full-time work, delivering the supplies on his feet 8 hours a day, and very, very happy and comfortable. So it can be done, and there is hope for these patients.
Absolutely.
Now I'd like to show you, this was a lady who unfortunately was addicted, and she had morbid obesity, and she was in a home. And part of what we did with wound care, and sometimes we really had the honor, and it was really so rewarding sometimes to work with some of these people, and you didn't have to worry about finances because you were donating everything to them. We had this special arrangement with this particular home. Anyway, so it took us a year to heal this lady, and we were using short stretch compression. And after going through 1 year of all of that, those wraps and coming in and back and forth and so on and so forth, put her in a Velcro device, and we watched her for 2 years, and she stayed healthy and healed. And I'd just like to show you, this is what the ulcer started like. And it was a very difficult ulcer to treat, but we did treat it, and here's the end result. And this lady's legs stayed that way for the next 2 years. So another thing is, Claudia, maybe you want to talk about this, the long term. You know, how do you get these people that once they're healed, they walk out happy as a clam, but how do you keep them that way?
Yeah, and the thing is, people they want to be done, which is understandable once this is all, they've gone through this, difficult time with a lot of compression bandaging, and they sort of want to move on with their life. But the condition that got them there has not gone away. And unfortunately, there's no way to really fix the underlying problem. So maintenance is key. There has to be follow-up. 30 to 40 stockings is ideal. Many people who need this kind of compression are not able to get that on. It's difficult both to get on and off, sometimes even with application devices. Many of them do have arthritis or other conditions that don't allow them to get at their feet and pull the way they want to. But the compression is still required. And the thing is, we have to get compression on in a way that's safe for them to do, because the skin is still a bit fragile. We don't want to be dragging, and scraping, but we need something that's going to protect and preserve the work that's been done after wound care.
Now, there's another classification of patients here, which is really important, and that is patients with combined arterial and venous insufficiency. And what we mean by that is that patients that have arterial inflow problems due to arteriosclerosis, so their pressures in their legs aren't quite normal. And it's very dangerous to put any kind of elastic on such a leg, because the elastic can shut down that circulation. And that's why we strongly recommend that to use Velcro devices, because they're ideal, because they have a low resting pressure. And if you put the Velcro device on with one of those measuring devices, that I mentioned before, and you see what the pressure is. And there's ways with gauges, you'll see when we demonstrate this, that we can simulate a pressure of the Velcro device. As long as the pressure of the wrap of the Velcro is less than the arterial pressure coming into the leg, it's safe. And actually, it's very, very important, because in that way, it prevents those legs from swelling. And when swelling occurs, then all sorts of bad things can happen, especially in patients who have surgery to reperfuse their leg, and then afterwards would have a lot of swelling normally. But with the Velcro devices, we control that very, very well. So in conclusion, I'd like to thank everybody for listening to us. And of course, it's a great honor to have Claudia here with us, because we get the real world, what it's actually doing. And Claudia's told me a lot of times that it's very difficult for someone who hasn't applied a whole bunch of different products of different kinds to different patients over a long period of time to really understand the nuances of these. And we know that Velcro devices should be considered in patients who fail stockings. Non-compliance is due to being able to put them on or off, failure to control swelling, morbid obesity, arthritis, patients over 70 to 80 years of age, and patients with mixed arterial and venous insufficiency, and an alternative to compression bandages for selected leg wounds, that sometimes you can treat the wounds with the bandages. So I'd like to ask you, Claudia, you have a very quality operation there, and you have very high quality products from multiple companies. There are a number of good companies that produce all of these devices, both stockings and Velcro devices. And somebody comes into you and you give them a quote, and you spend a lot of time with them, and you sort of work with them. And then they thank you, I'll take it under advisement. They go back, they go on the internet, and they order something.
Yes.
Tell us about your experiences with patients that do that.
Yeah, it's difficult, and fortunately, it doesn't happen real often. We try to develop a relationship and a level of trust with people who come in. When we're looking at a patient, every single patient, we sort of are putting through this rubric of, what garment will fit, what garment will be comfortable, what garment can they get on and off, what's the shape of the leg, are they prone to swelling above the knee, are they prone to swelling in the foot, and there's cost and and ease of application. There's so many things we can have to take into consideration when we work with the patient, and we know our product, and even we know the products well, and even then it sometimes takes a little bit to sort out what's the best product. So for someone to go blind online, it seems to me impossible to be able to find the best thing for somebody to do it themselves without having the experience.
Well, I'd like to emphasize the importance of what Claudia just said with a personal story. Now, I was a part of my career was a doctor on the ski patrol, and I had a very serious injury in my leg, and I had a long rehabilitation, and I had swelling, and I needed to wear bandages, and I wore Velcro devices and so forth. And finally, I got all better, and I was in what I thought was a really good stocking. Now, remember, I've been doing this for nigh on to 50 years. And I called up Claudia because I said, Claudia, I'm having problems with this stocking. I thought it's a great stocking, a great company. It's not working right for me. So I go in and see her, and she says, yes, you have one of these. There's 3 or 4 or 5 companies that have been in existence for like 100 years. Most of them come from Europe. They have a lineage. They're fabulous products. I said, not working. And she says, well, Joe, she says, I hope you don't mind me telling you this, but you have a duck foot and you're in a ballerina foot stocking. That's not going to work. Plus the fact is the weave on this stocking is not suited to the configuration of your ankle and foot. And I want you to try to this other stocking. And so they were both relatively the same price, both reputable manufacturers. And now using that stocking, I have done very, very well since that time. And so that's just an illustration of why it's important to get the right product. Because when you get the wrong product, then you have to pay for that online. You're going to have to only come back to a fitter to get the right product. So in any event, I'd like to thank you for listening to this. And it's a great pleasure again to be joined by Claudia. And we're going to conclude our remarks now, but there's going to be a part 2 where we're going to be applying and removing Velcro devices. And I hope you will watch and stay tuned for that. So thanks, everybody. Stay safe and have a great day. Thank you, Claudia.
Thanks, Dr. Caprini.